Hi, today we're going to be talking about healthcare informatics and interprofessional education, starting with the KU Standard 64, which includes and details how medical professionals across various fields protects and manages their patients' records, including but not limited to these various aspects.
Next, we're going to talk about HIPAA, the Health Insurance Portability and Accountability Act. It was created in 1996, and this was to ensure the patient's protection of all their medical history, and this goes for all medical practitioners. So within HIPAA, the patients have the right to request access to all of their patient information, amend anything that they may want to change within that information if they find a fault in it, restrict sharing between healthcare professionals, as well as they have the right to request disclosure and accountability. And then we have the FERPA Act, which is the Family Education Rights and Privacy Act, and it was created in 1974. And this is to protect all students' information that could be used to identify that student. So that's information regarding their grades and stuff from academic standpoint, as well as any information that could be healthcare related or health central if it comes from that education location.
Everyday athletic trainers are required to document injuries, treatments, as well as medications they provide. A helpful way for us to do that is to use a SOAP note so that we are able to remember this information at the end of the day. So SOAP stands for Subjective, Objective, Assessment, and Plan. So subjective notes are anything that's reported by the patient themselves, so something that we wouldn't be able to objectively see. So this could include past family history, or past personal medical history, as well as anything related to the injury that has occurred. Objective notes involve anything that's done by a clinician to assist with diagnosis. So this could be, for example, a Lockman's test to test for an ACL tear. Assessment involves summarizing all of these findings above and stating the diagnosis of that patient. And finally, the plan is summarizing the treatment plan for that patient moving forward. So this could be anything that you had done for that patient today. We use these at the end of the day to log onto our electronic medical records, where we will keep a log of all injuries and any treatments that we've done.
So now that we're taking in all this patient information, we have to make sure that we protect all the medical information. And that means protecting anything that medically wise, but also personal. If they say anything to us, we need to protect that information. And we would do that by, if we have papers, we need to make sure that they're locked in a filing cabinet in a locked room with only access to that room by the athletic trainer. If you're having their medical information on a computer, we would want to avoid personal computer usage. And then also we need to have a secure VPN and security software uploaded onto that computer, as well as make sure there's a username and password for accessing all documents. And then if you're just speaking about information, you need to maintain the coffee shop rule, which is not saying anything that you do not want to be overheard if you're standing in line in a coffee shop. So any personal information should not be shared to anybody, but especially in that sort of way.
All right, so the last topic that we're going to discuss is aspects of effective communication. So communication should be complete, clear, brief, and timely. For communication to be complete, you should be sharing all of the important details regarding a situation, but avoiding unnecessary details. To be clear, you should be using standardized language across medical professionals, and making sure that the person you're discussing this with understands all of the information you're telling them. To be brief, it's pretty simple. Just be straightforward, be concise about what you're sharing. And timely, ensure that you are sharing this information as quickly as possible. This is a very common aspect of athletic training. We need it for various situations, including transfer of care. For example, if an athletic trainer is transferring an athlete to an emergency medical professional to continue their care. In addition, like a pre-game meeting or preseason meeting to discuss emergency action plans. And finally, speaking with patients, coaches, parents, other medical professionals about the care of your patients.
So there are 5 goals for healthcare professionals when treating patients. And the first one is patient experience. So we want to maintain a patient-centered care and just ensure their comfort and they are communicating with us throughout the whole process and we are doing stuff to serve them. Second is population health, which is maintaining and ensuring that the whole group is cared for and we aren't caring for one person over the others. Next, we have reducing costs. And so this is particularly important for maintaining patient costs and experience, but also making sure that we aren't using anything that we don't need to and making our costs higher. Okay, fourth, we have care team well-being, which is ensuring that the healthcare professionals you work with are also taking care of themselves, because they can't help others unless they first maintain their well-being. And fifth, we have health equity, which is ensuring that we address any injustice in the healthcare system.
Another key aspect for us to consider is the interprofessional education with the 4 main goals. The first being values and ethics, which is where you as an athletic trainer hold yourself and your coworkers to an optimal standard of patient treatment so that everyone is being treated equal and with mutual respect. Roles and responsibilities comes into play with your preseason meetings by setting various roles of if someone goes down injured, where you are going and what your job is. Also understanding the capabilities of your team so that no one is feeling as if they are putting too much weight on themselves if they are not comfortable doing so. Communication that falls into this with your open and closed loops during emergency situations. Open loops are where you're asking more questions based and statements based on you're looking for feedback, with a closed loop being what you say to someone, you want them to repeat back to you so they are doing exactly what has been said and going to retrieve what has been asked for. Team and teamwork then, that is you working with your coworkers, coaches, and EMT professionals to maintain a safe environment for your population.
So when we're working in teams, we want to follow this collaborative model for success, which is, if you are the leader, having collaborative leadership, which means to listen to those you're working with and using all of our experiences and sharing together to protect and help the patient in the best way possible. Then we have team functioning, so that includes proactive preparation for all situations that may occur, so EAPs, as well as just maintaining good plans for treatment. And then we have recognizing authentic experiences between team members, so we want to respect everybody else's experience because they are true, and we can learn from those experiences even if we haven't had them ourselves. So that is good communication within team members to learn from them. Next, we have continuity of care, and this leads to improved patient outcomes. So when working with a big team of healthcare professionals, you may not always be working with the patient, so you need to keep good notes and documentation to hand off that care to somebody else, and as long as it maintains a good path, we will be good. And then we have conflict resolution. So in leadership, you need to make sure your team is working well together, and if any disputes arise, you need to listen to both parties and make sure that the conflict has been resolved and there's no standing like anger or anything amongst the team to maintain that good team functioning.